Good evening. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for another Facebook Live session. Tonight I am joined by Dr. Jeffrey Laut. He's a nephrologist at the Hartford Healthcare Tallwood and Urology Kidney Institute. Thank you so much for sticking around.
You're welcome.
And talking to us. Dr. Laut was just on Channel 3 Medical Rounds, and we're going to continue the conversation with him right now. He's a nephrologist, as we mentioned. Not many people, it's not a specialty that we hear often about, but it is in relation to the kidneys. What exactly is a nephrologist for the audience out there?
So nephrology is the study of kidney and kidney disease. And here in America, the lion's share of that is diabetes, but there's a large spectrum of diseases that affect the kidneys, damage the kidneys, and people end up requiring the care of someone who can optimize their kidney function and try to prevent their kidneys from deteriorating in the future.
So you mentioned diabetes, hypertension. A lot of Americans suffer from those two conditions. Talk to the audience about how that relates to kidney function.
Okay. There are, as I said, certain diseases, toxins, medicines, etc., that slowly over time can have an impact on kidney function. As we age, our kidney function slowly declines from decade to decade, and that's a natural process. But if something happens during your life where your kidneys are damaged or insulted by surgery, by a medicine, by a disease, that decline is accelerated and your kidneys may fail before the end of your life. And we get involved as long before that as possible to help prevent that.
And how do you help prevent that?
Well, one general statement I always make to my patients is, if you stay healthy, your kidneys will be healthy. And I know it sounds redundant, but being healthy and fit, controlling weight, controlling blood sugar, controlling blood pressure, all of those things have an impact on our kidneys. And then there are other more sort of fine things, fine tuning that we try to help patients with. And through that, their personal habits and our medications and therapies, we try to give them a healthy kidney life.
Mm-hmm. We always hear about water, and drinking lots of water can help with the kidneys. How much water should we actually be getting?
I think there's a little bit of a myth with water intake. Yes, it keeps us urinating and it keeps us hydrated, but we can overdo it. And the body is equipped with very sophisticated means of telling us if we have too much or too little water. And that mechanism is simple thirst. When we're thirsty, we should drink. But a lot of people overdo it and actually get in trouble. And some people don't drink enough, and it helps them if they do stay a little more hydrated. But listen to your body, as you've always heard, and that really works very well.
Your body never lets you down, right?
Correct.
So we're talking with Dr. Jeffrey Laut. He's, of course, a nephrologist at the Hartford Healthcare Tallwood and Urology Kidney Institute. On our Facebook Live session, we do, Dr. Laut, have a question from Kathy. She says, I had a left nephrectomy due to kidney cancer, stage 3.
Okay.
That's all it says.
Okay. Well, without any other questions, you are a little more vulnerable than somebody with 2 kidneys for developing advancing kidney disease, but not necessarily so. Many people live an entire lifetime with 1 kidney. Mm-hmm. We have multiple patients who give up a kidney for a loved one for kidney donation, and they do very well. So hopefully, Kathy, you're in that pool, but certainly we'd have to know more details about you. But you can live a long, healthy life with 1 kidney.
Mm-hmm. There is, we should mention, an upcoming class coming up next Thursday, March 23rd in Wethersfield, Understanding Kidney Cancer, but any questions that you may have about kidney. So Kathy might want to check that out. You do need to register for that class, and you can go to 1-855-HHC-HERE to register and sign up for that class. One thing you and I were talking about earlier, and I found to be so interesting, was that you could have a tumor in your kidney, malignant but benign, and based on the size of that kidney dictates or determines surgery or not.
Okay. So by malignant, we mean that the tumor is cancerous. By benign, we mean that that tumor will not necessarily harm you. And it does depend on the size of that tumor. Small tumors tend to cause little trouble, and we can often watch them and periodically measure them and see if they grow. If they don't grow, typically they cause no harm. If they grow quickly, they need to be rapidly addressed and removed. But a person I have many patients who live with a kidney tumor as long as we're keeping an eye on it.
We call that active surveillance. Right?
Correct. Yeah, well, watchful waiting. And that approach has really helped in the population that I talked about early, elderly, diabetes, already pre-existing kidney disease. Those patients can't afford to lose any kidney material or function, whatever you call it, because they are more vulnerable.
And as you continue to watch that, if it gets to a certain size, then maybe surgery is an option, a viable option.
Absolutely. I don't like to throw out numbers, but I think the magic number in kidney tumor size is around 4 centimeters, which is like 1.5 inches for those not accustomed to metrics. But we get very serious about those. And less than that, the tumors that are 1, 2, and 3 centimeters, we try to take a careful look and make sure that removing that tumor with part of the kidney or the whole kidney is going to be beneficial to them and not more harmful to them.
Right, or lead to other issues.
Correct. Particularly progressive kidney deterioration. As you chop away at kidneys and take pieces away, the rest of the kidney has to do the job of 2. And that causes a process that sometimes create kidney damage. It overworks.
What happens during that watchful waiting period in terms of the patient's responsibility? They have to come back every so often. What happens during that period?
Absolutely. Depending on the physician, the urologist, more often than not, the patients need to come back periodically, maybe every 3 or 6 months, get re-imaged, pictures taken, and compare it with the picture from prior and see if it has grown. And this way we can assess its growth potential, which is frequently related to a bad actor, tumor.
Now, if it does get to that certain size and surgery is an option, there are robotics involved, there's laparoscopic surgeries to really target the tumor and not really affect anything else, right?
Well, the best thing about being here at Hartford Hospital is my urologic colleagues are very well versed in robotic and laparoscopic surgery, and they can operate with greater precision and remove the smallest amount of healthy kidney tissue that's needed to get rid of that tumor.
Okay, we have a question from Joe, and he says, can you address recent studies regarding long-term use of like Protonix effect on kidneys?
I can certainly address it. If I quote the studies, they have found that the long-term use, and I mean month after month, year after year, of medicines like Protonix, that there is an association with worsening kidney function. Now, all of my patients came running to me and said, should I stop my indigestion medicine, Protonix? They're all the same. And I said, no, you could be on it for a month or 2, but you shouldn't continue it every day indefinitely. You should check in with your physician and ask if it's okay to proceed and continue the use of that. Some people are very dependent on it, and they have terrible symptoms without it. So.
All right, good question, Joe. We hope that answered your question. Kathy from before has written in again to clarify her question. I am on Ibuprofen 800 milligrams. Will that damage my only kidney?
Potentially, yes. And again, I tell most of my patients they can use medicines like ibuprofen occasionally and sparingly, but they can't take them every day continuously. It does have a definite theoretic toxicity for the kidney, And I would recommend medicines like Tylenol and the limited use of medicines like ibuprofen.
Yeah, because even if you have two kidneys and you're on that for a prolonged period of time, it is damaging.
Correct. So you're more vulnerable when you have one kidney.
With just
Absolutely.
one kidney. What else can Kathy be doing to sort of preserve that one kidney that she does have?
So again, I'm going to be obnoxious and reiterate good, healthy living. People who cure their diabetes by weight loss and other means do very well. People that take their blood pressure medicines and have very good blood pressure control do well. People that stay active and avoid some of the toxins that we talked about today. The Protonix of the world, the Ibuprofen of the world, those should be minimized, not necessarily eliminated. But those are some fundamental things that really can, if people pay attention and take good care of themselves, they can usually look forward to preserved long-term kidney function.
So we are talking with Dr. Jeffrey Laut. He is a nephrologist at the Hartford Healthcare Tallwood and Urology Kidney Institute. We encourage you to ask a question while he is here with us live. There's also a free class coming up next Thursday. That's going to be held in Wethersfield on March 23rd. You do need to register for that class. It's Understanding Kidney Cancer. But anything you want to know about that or about the kidneys in general would be a good opportunity to attend that class. You do need to register for it. If you call 1-855-HHC-HERE to register for that class. And it looks like we have a question. Can diet soda consumed for long periods of time be damaging to the kidneys? Interesting question.
Anything consumed too much and too long is probably not good for you. The diet sodas of the world have been implicated in kidney stone formation. And I would certainly warn anybody who does have a kidney stone problem to minimize their diet sodas. Outside of that, there's not been any studies that actually said they damage your kidneys. But if somebody gets enough kidney stones, that in and of itself will be damaging.
Right. Are kidney stones hereditary? Are those genetic, or is it a combination of genetics and foods that we eat that result in kidney stones?
It's everything.
Yeah.
Some people have very strong genetic predisposition to causing stones. Some people's diets are terrible, and they eat a lot of things they shouldn't be eating and sort of promote stone formation. So it really is everything from nature and nurture, and we see all sorts of stone formers, and each person needs their own analysis so that we can figure out why they form stones so that we could target their therapy.
And what are some of the therapies to prevent stones if somebody is predisposed to having kidney stones? What are some of the treatments that you offer?
So the number one piece of advice that you'll always hear and is true is to drink a lot of water. So that's a little different.
There's where the water comes in.
That's correct. Having dilute urine prevents saturation and stone formation. So it really does work. And I'll just throw out a couple of other, not old wives' tales, but proven therapies. Lemons and lemonade are excellent to prevent stone formation. But then after that, it turns out to be very specific. We try to find the exact problem or disease that's causing their stones and target it specifically. The first two things I mentioned are good for all stone formers almost, but then we need to drill down and get a more specific therapy.
Okay, looks like we have another question. Let's see, I eat a lot of Tums due to heartburn. Can I get kidney stones from eating too many Tums?
Yes, you certainly can, and you should probably discuss that with your doctor and make sure that the zealous consumption of Tums isn't doing things inside your bloodstream like raising your calcium. You definitely can create a syndrome where you start forming stones. I would tell that person to have somebody check out why you have such bad indigestion, and look into that instead of eating
consuming too many Tums. Yeah. And I think the key message here, it sounds like what you're saying, is that everything in moderation, with ibuprofen, with Tums, with medications. If you overdo it, that can damage the kidneys.
Absolutely. There's
If
no
you
question
overdo it
about
for a long period of time, an extended period of time.
Agreed. Agreed. Yeah, I frequently not only warning patients, but also tell them to not take too much of this too literal, that somebody doesn't want to take one ibuprofen in their life, which is probably silly.
Which would be silly. Okay, we have one more question here. Does kidney cancer run in families? Is it hereditary?
That's a very good question. Now, it is not one of the most hereditary cancers like we see in breast cancer families and colon cancer families, but there is a definite gene abnormality where kidney cancer runs in the family. Fortunately, it's relatively rare, but absolutely can occur.
Could that be something where genetic testing comes into play?
Slowly but surely. The genetic testing is sort of just ramping up in regards to cancer screening, and there are definitely well-known genes that cause certain cancers.
Yeah.
In the kidney cancer world, that's still developing.
Yeah, like we hear in breast cancer, the BRCA1
Absolutely.
gene, and kidney
Yep.
cancer, there may be a gene.
They're well-known and part of everyday testing now.
Right, okay. We have another question here from Tanya. Another kidney stones, popular. Can you get kidney stones from taking calcium supplements?
Just like the person who took Tums,
Right.
Tums, I should tell you, is calcium carbonate, and the answer is yes. If you take calcium supplements, you should really only take up to a total of 1,200 milligrams of elemental calcium a day. When you read it on the jar, it'll tell you. But take it for a good reason. Let your doctor tell you that you need supplemental calcium. Or vitamin D, the same thing. People take a lot of vitamin D these days, and we see people getting stones from just ingestion of vitamin D.
Yeah, and you see a lot of people that take supplements just not even under a doctor's care. They're all over. They're easy to get. You just go down the sort of the nature aisle, and they're right there, and you don't know what you're really taking. I mean, even though they are supplements, taking many at a time or mixing them can pose problems, right?
I agree 100%. I see it all the time, and it's almost overwhelming. I can't even figure out what's good and bad for them. None of the supplements are FDA cleared,
right.
And it gets very, very funny.
And I think oftentimes people may not tell their doctor that they're taking supplements because they're not prescription-based, so they think,
Correct.
Well, how harmful can it be? But the important thing here, I guess, is to tell your doctor with whatever supplements you might be taking.
I agree. We've come up with a lot of good truths that people should live by.
Well, really good information. Thank you for sticking around, and hopefully our audience, our Facebook audience, learned something. I certainly did. If you would like to learn more, again, there is that free class coming up next Thursday, March 23rd in Wethersfield. I encourage you to sign up for that. You can learn much more about kidney cancer and kidneys in general, kidney disease. You do need to register. That number is 1-855-HHC-HERE. Thanks once again for joining us. Dr. Laut, thank you.
Thank you.
We'll see you back here next week. We'll see you soon.